welcome to our first Brain Talks podcast of 2022, as we look ahead to the EBC's Brain Innovation Days in October this year. I'm Sam Polly, and it's an honour to be hosting this series, during which, throughout the 12 podcasts, we'll be looking at the innovations taking place right now in the Brain in the Life course, starting with pediatric neurology and working our way through the life cycle. In each episode, I'll also be joined by a guest co-host from the European Brain Council. And today, we'll be looking at work taking place in pattern recognition muscle MRI in early onset muscle disorders, which recently was recognised by the European Paediatric Neurology Society as outstanding and innovative research and was the winner of the EPNS Research Prize. Well, joining us to tell us more about the research and its potential impact, I'm delighted to welcome Dr David Gómez-Andrés, a specialist in child neurology at the University Hospital of Vall in Barcelona and a member of the European Neuromuscular group at EPNS. Professor Thomas Sayerson, a senior consultant and lecturer at Karolinska University Hospital in Stockholm and a board member of the EPNS. And sitting in our guest co-host chair this week, Christine Arts, project manager at the EBC, where she's primarily responsible for the delivery of European projects such as EBRA, the European Brain Research Area, which streamlines and better coordinates brain research across Europe whilst fostering global initiatives. A very warm welcome to you all. So, David, let me start with you. Can you tell us a bit more about what the European Neuromuscular Group is and how this research came about?
Well, in the European Paediatric Neurology Society, we have a very interesting way of working. We have like a research meeting, a normal meeting. So in the research meeting, we are divided into group of study, and one of these is the Neuromuscular group, which is devoted to the study of pediatric neuromuscular disorders.
So what is the research that we've been talking about today that you've been conducting, and what were the processes and the tools that you were using?
The problem we have in pediatric neurology is that most of our disorders are rare, and that makes them difficult to be recognized for clinicians. So although we are improving our tools to make a precise diagnosis by new generation sequencing, we still need from the phenotyping part of the diagnosis process to be done. And imaging is a very interesting one. So patients with different neuromuscular disorders have different patterns of involvement in their muscles, and we can detect them by ultrasound or by magnetic resonance imaging. And we have been doing this for years, and what we are changing now is that we are using computers in order to make interpretation much more easier. And we are using artificial intelligence and machine learning in order to make this process more fluent and more easier for everyone. So in the previous years, we need an expert to make the interpretation, and now we are making simple rules or algorithms that can help in the diagnostic process.
Sorry, Christine, go ahead.
Yeah, very interesting, David, to hear about this. And what were exactly like the findings of your research? Like, what are you doing exactly? Because now you're using these tools and methods.
Yeah.
But what do you find with them?
We are in the part that we are collecting muscle imaging for rare disorders. So we are now describing the patterns using whole body MRI and ultrasound. And we presented in the large research meetings and results regarding several rare early onset muscle disorders. So we study the muscle disorder, the muscle fat infiltration through semi-quantitative images and we make representations of the muscle involvement and use tools to differentiate them. We have studied LEMA2, we have studied selenoprotein-related muscle disorders, and we are moving into studying more complex things like the teething-related muscle disorders or the nebulin-related disorders, which are much more complex and they do not have a clear pattern.
Thomas, let me bring you in here. This work was recognised by EPNS with this award. Why do you feel that it's such important research, and why is it so innovative? What's innovative about it?
Well, let me first start to point out that the research project that was awarded that David is performing, it is an ongoing research project. So it's not an award for finished work, and the reason that I and we in EPNS found this to be so important, it is really that it really covers a knowledge gap that is considerable, and where there is enough good techniques available, methods available, skilled personnel available to address those questions. And this knowledge gap is really about, like David said, to get a good phenotypic description of muscle by help of imaging. And this has both very large clinical as well as research implications. And then apart from the importance, then also David got this reward because he presented it in a very nice and clear way. So this combined led us to awarding David for that.
Christine, would you add anything to that? Why do you think it's so innovative? What's so important about the work?
No, I think what is really interesting about this work is that it also really addresses like a very important field in brain research that actually often is, let's say, a bit ignored in brain research because it's neuromuscular. So it's really like on the borderline of different fields. And that's probably the reason why often like researchers are not paying too much attention to it because they're focused on one field like neurology or muscle, but the link between the two is often, like, as I already said, a bit ignored. So I think this kind of awards really highlight an important field in brain research. So
David, would you agree with that? Would you add
Yeah, I also feel that one thing that is really interesting is about the possibility of these enabling technologies. So it's not, I am a pediatric neuromuscular specialist. I feel that it has a great potential in my field, but well, we work in different things and the impact will grow if we can export the things we can do in neuromuscular disorders into other areas of pediatric neurology. And we are doing that now, and I think that the way we start to think about our problem is also applicable to other areas of pediatric neurology and neurology in general. And I think that is also a part of the innovation in the project. So we have to deal with complex problems with a lot of dimensions and also with the limitation of facing rare disorders. And this is something complicated from the technological point of view. And I think we have been doing good work on that, and it's not all of me is a collaborative project with people all around Europe, and this is also something which is nice and important to say.
And David, you said there's a lot of potential there. Can you give us some examples? What potential do you think that this work has now and in the future?
Yeah, now, for instance, we can apply the results. And one of the results we presented, it was about LEMA2 muscular dystrophy. So we study patients from all over the world, mainly European patients, but we were able to define a clear pattern and know how this pattern changes along the disease evolution. So some months ago, when we were submitting the paper, a patient came into our consultation, and we got the results from the muscle MRI and performed a muscle ultrasound, and we were able to detect the pattern, and we have very clear that the diagnosis would be late mature, and it was like 15 minutes, a 15-minute consultation. So that when we are working with that, now we have to order a whole exome sequencing. Sometimes there are results that cannot be found in the new generation sequencing techniques we are using. So if you have a very clear diagnosis, you will move into a muscle biopsy, or you will do things, but you will do things in a very orientated way. And the thing is that techniques we are using, we first start in applying them to gait problems, for instance. So we got results from the kinematic and kinetic information we can start for gait analysis, and we apply them into pattern recognition in rare pediatric gait disorders. So it's a very enabling technology. Neuromuscular disorders is an important, and we got a very sophisticated pipeline to do that, but it's also true that we are doing things that can be applied in different fields. And in pediatric neurology, we are seeing the application in our normal and real life.
Christian, I'll come to you in a minute to talk about the European collaboration side a bit more, but Thomas, is there anything you'd like to add about, the impacts that you think this research could have now and in the future?
I think David covered it all in his description of the work, but to briefly sum up, I think some of the important parts of this is, first of all, that we finally bring neuromuscular into a field where imaging is used, similar to like we have for decades used imaging for discovering the diseases in the brain, and this has been lagging behind. And now, as David said, this can be brought into the field of neuromuscular, both diagnosis and also to follow the progress of a disorder. So the pattern recognition for diagnosis, and to follow this over time to follow a natural history of a neuromuscular disorder. And thirdly, also to follow the treatment of a novel treatment of a neuromuscular disorder. So those three parts, I would say, are important implications of this methodology.
Christian, this has been a really great example, would you say, of European collaboration?
Yes, indeed. I think this is exactly what the European Brain Council is also supporting, and especially in the European Brain Research Area, or EBRA project. So I don't know if you're already aware of it, but within the project we have these EBRA clusters, as we call them, which are research communities gathering different researchers from all over Europe, working on the same topic and really addressing overarching issues within the field. So instead of staying in your lab, you really group as a research community, and the idea behind is that such collaborations, of course, are accelerating innovation. And this leads to another initiative from EBC, of course, the European the Brain Innovation Days, for which this podcast frames into this into the Brain Innovation Days. So I think this is a perfect example, and we also hope that you and similar communities will be present at the Brain Innovation Days, actually, because we need to highlight this.
For people who are listening to this podcast, David and Thomas, what would you say? What if they, is this something that could be put straight into practice anywhere, or are there additional requirements, additional needs. Thomas, let me come to you first.
Well, I think there are different levels of this. Like David said, it is not only, his project is not only about the straightforward use of MRI, it's also adding the importance of artificial intelligence and other aspects of the methods. But step by step, we could definitely, and we are, implementing the use of MRI imaging for neuromuscular disorders now, here and now. I think we should do it more. And this is a process that I would say is ongoing all over Europe in many centers. And it is ongoing in particular for areas of questionable diagnosis, like David touched upon. You get some maybe variants of unknown significance in some genetic search, and you want to see if there's some pattern that is recognizable. And with time, these sort of atlases of how specific patterns correlate to specific neuromuscular disorders will grow more and more, and will tell us more and more. So there it is of importance. And also a second part where we use it now is also to try to characterize how extensive is a dystrophic change in a muscle. That would guide us somewhat to what can we expect from treatment also. So those areas I see here and now that we really could use and do use. And then we would add on in the future the aspects I think that David are really working on to make it more sophisticated. That would take more learning and more expertise to be spread from the ongoing work from David and the network around David.
David, Thomas just said more learning, more expertise. Would you agree with that? How do we?
Well, I think that is true and it's not. I mean, my feeling is that once we are starting collecting information, once we get the enough information, we will be able to apply that in a very simple and straightforward way. I mean, we are working in different ways of understanding the information we have. So we try to recognize a pattern through sophisticated algorithms that are able to collect the imaging and directly give a possibility for diagnosis. And this is extremely interesting because it's an automatic way, and you can use this information in places where they do not have so many resources in terms of abilities to make the diagnosis. But we are also doing the other way. So we got a very complex information and we are trying to collapse it into very simple imaging findings that a radiologist or someone which has experience who has experience on the field is able to provide a diagnosis. So if you have this and this, it's very likely that this disease is happening. But if you don't have that combination of findings, it's very unlikely that you are facing that disease. And this is a process of using very complex algorithms that are very difficult to interpret, for instance, deep learning, and other algorithms that are much more easier and very old ones like association learning rules. And we are working in all around the complexity of the algorithms in machine learning to make that pattern recognition works. So probably in the future, I can imagine that there will be like two different kind of users. One that is an expert user that will get the imaging into a computer or into a network, and that will give you possibilities for different diagnoses. Another one, which is the expert one, that probably will use the same program. They will get some automatic information, but he will or she will be able to make an interpretation, and that will be based on the work of using simple machine learning tools. So I mean, it's normal that in medicine. So the very first doctor that participates in the diagnosis procedure will be someone younger or with less expertise on that disease, and you will find someone who is really an expert on that, and he or she will give you help regarding that disease. And I think that in the imaging and the algorithms around the imaging interpretation, we will have a very similar situation.
Christine, how do you see all this sort of work panning out and sharing information that we're talking about there? I know that the European group is working on mapping as well, David, is that right?
Yeah, we are collecting information for disorders where the patient is not so really known, and we are trying to implement projects for collecting large number of imaging because we need that to fit the more complex algorithms. So we are trying to collect that information through the Neuromuscular EPNS working group. We are also using the European Reference Network and other important actor or in the field was the Mayo MRI working group, which was a cost action program that was devoted to mass neuromuscular imaging, who has made like a network of centers who has a very particular interest in neuromuscular imaging. So using these three tools, we are trying to develop projects. And it's true that when we started, we were using like unicenter small cohorts, and now we have multi-centers, large cohorts, even for more rare disorders, which is something very nice to happen because you will get much more information.
No, indeed, and it's actually also happening also in brain research. Like for example, again referring back to the European Brain Research Area, we have one of the clusters is the European Cluster for Imaging Biomarkers, and I think last month on the 7th and 8th of April they organized a meeting to really discuss on how to share these data, imaging data, because there is still no solution. It's not like a simple Excel file, let's say. It's like personal data, so anonymization is important, and there are many issues. And I know that the European Commission also has this, or is working on the creation of a European health data space. So how does it actually fit into this like very, very broad framework, like when you would see it at European level, even linking, I don't know, with brain imaging data, like with other kind of imaging data, and then to go even more ambitious or more to generalize it even more at global level. Like, are you also, for example, working together with the US? I'm now saying US, but of course it can also be Japan, Korea, China, I don't know, all these. Is there something already happening like at international level?
Thomas, maybe you could respond to that.
Actually, I think David would have more information of this concrete collaboration.
It's a complete mess. I cannot say it more clear. Well, I think that we definitely need a system to do this. We were thinking about different possibilities in a project that we try to get, and we also think about the possibility of using federated approaches, which is also interesting. But we definitely need a rule that helps this to happen, because we desperately need to do this for rare disorders studies in general. So it's very complicated. In imaging in genome sequencing, whatever, we need platforms, and we need that information is available all around Europe, not only for research, but mainly we also think that it is very important to have that information for the citizens that are traveling now more around Europe. So Europe is making like a very common space now, and we need to have that information in place. So I can be in Edinburgh in 2 hours. So we need to have a system that share information.
Christine, how do we get those platforms? What's needed there?
Yeah, I think a lot is needed there actually. No, how I can see it is just that within EBRA, of course, we have these clusters. So what they do is that they address the challenges and they write papers with recommendations. And this needs to be communicated to the European Commission as a signal like, okay, this is what the community needs. These are the priorities, and linked to this, speaking about priorities, of course, we also wrote the Shared European Brain Research Agenda, which will be sent to the Commission. So in a way, this is all about communication between the scientists and the policymakers, because of course the scientists are experiencing these issues. They find like solutions, but often support is needed to fund also these solutions probably, and to really focus on this. So this is what I hear in these in all these cluster meetings, infrastructures and general rules on how to share data, like all kinds of data then. And then platforms that are existing, I think there are already existing many. For now, the one that I'm thinking of, like the most general one, as I already mentioned, is the European Health Data Space. But of course, there are like many others. So, and then there is also the thing that within, ideally we would have like one platform. So creating one platform and another, and in the end having like 1,000 or different platforms which are all having the same aim is also not really useful. So we need to avoid, let's say, what we call it within our project, fragmentation within the collaboration, or fragmentation within the creation of such platforms.
We're nearly out of time, so let me just start wrapping up a little bit. I'd love for you all to give me a takeaway message at the end, what you think is something that's really important about this work. But just before we do that, in a sentence or two, David and Thomas particularly, and maybe Christine as well, you know, when we're talking about the patient, the person living with one of these neurological disorders, what is the difference that this work could have on their lives? Thomas?
Well, first of all, it could really influence a child who has an unknown neuromuscular disorder. It could really help for diagnosis. It could also help a child who has a neuromuscular disorder and you're not really sure about what kind of therapy is the best, and where that therapy would be dependent on the changes you see in the muscle. And there, the MRI could be very beneficial in helping that patient. I would stick to those examples.
David, anything to add to that?
Well, I think that early diagnosis is crucial for these disorders, and diagnosis changes the whole management of the patient. So I think that is the key. And also the genetic counseling for the family can be also very important. And so this is why we are doing this work. And the other reason is because it help us to understand the physiology behind the disorder. So we are able to see the disease in a very different way that we were used to do. And this is something also very interesting and opening questions for research that we will address in the near years to come. And this is probably the best thing we can do through imaging, is to do these three things.
Christine, would you add anything to that before we go on to the takeaway messages?
For the patients, I would just say that collaboration with the patients is also important, actually. So it's not really like why is this research, or what is this how beneficial is this research for the patients, but also saying that patients should be included in this in the development of the research, and that we should listen to their voice within this in research in general, actually. So that's my bit here.
Let me just finish with a final comment from you all. What would you say is the kind of key important message that people listening today should be taking away, or what is your hope for the future? What's your ambition for this? David, let me start with you.
I think that collaboration is critical for rare disorder research, and that machine learning can offer a different way of understanding the data you have.
Thomas.
Well, my take-home message, I think, would be that in the very near future, I think we would see MRI and neuromuscular diseases growing to the same importance as we do for brain disorders, which means a very high importance.
Christine, that would be welcomed. The two comments from David and Thomas, obviously those would be fantastic. How about you?
No, I can just say that we as EBC, we support these collaborations, and that we hope that we can support these kind of initiatives in coordinating meetings on general issues, and then also to level this up to the global level, actually, to not only stay at European level, but even try to collaborate with the US to even have more impact.
Well, we'll leave it there. That's the time that we've got for today. But thank you all for joining us. It's been really interesting to hear about the work. And thank you for being here on the Brain Talks podcasts. Thank you also to everyone for listening or watching in. And do join us again soon for another podcast as we look ahead to the Brain Innovation Days. And we continue to explore the brain in the life course. Until next time, thanks and bye-bye.